when I came back here in 2011, one of the things I heard was, as I talked to my philanthropic colleagues, was, well, we're doing this in healthcare. We're involved in healthcare in this way. We're involved in health in this way. And so it began to be clear to me that sort of the 3 or 4 foundations for whom health was a primary focus, like St. Luke's, like Legacy, like Flynn, now there were a number of other folks engaged in that conversation. We thought, you know, it'd be a really great idea to have a place where we could all come together and see what each other's doing, learn a little bit more about what's going on. So talked to Marissa, and just about a year ago, we formed the Healthcare Affinity Group, or the Health Affinity Group. And it's a work in progress. We've really had maybe 3 meetings, I think, over this first year. More of a steering committee type, and sort of thinking through what we want to be doing. And this year, sort of the kickoff, I think, of trying to engage more folks in the conversation. And as Marissa said at the outset, I mean, for us, it's really about 2 relatively simple things. One is helping folks understand sort of what's going on in the community from a policy perspective, from a whole range of issues related to health and healthcare, and also just to the Better Business Bureau conversation. You know, what's going on, what are we doing? You know, do you know anything about this organization? So we can sort of fill each other in. So far, we've sort of focused on health care by we're having a lot of conversations, of course, with the Affordable Care Act coming online here in January of next year, around health policy, and particularly how it plays out in Arizona, and how we can be engaged in that and the meaning of that for all of us. We've also looked at graduate medical education, workforce issues, and coming up on March 7th, I believe, our next meeting, we will be looking at behavioral health in Arizona with a particular focus on what they call mental health first aid. And so we encourage folks to be involved. But I want to say that those tend to be sort of health care focused issues. But as a group, and this is sort of our bias from St. Luke's, but we're imposing that bias, I suppose, on the affinity group also, which is that health is more than health care. That health care is really a small piece of what affects people's health. And so this affinity group is looking beyond health care to such issues. The sort of phrase that everybody uses is, you know, health is impacted by how we work, live, and play, or where we work, live, and play. And so we'll be looking more broadly at a range of health issues and how they impact things like the built environment and how that impacts health and how we as groups can be engaged. So I encourage those of you who aren't engaged specifically in health care to think about ways you might want to connect with this group around health more broadly. One of the great lines, sadly, is that zip codes can predict our lifespan, and we ought to be addressing those kinds of issues. So I invite you to be part of this. As I said, the other part of our work is just sitting down with each other and talking about what we're doing, what each group is doing, learning a little bit more about how we're all engaged in health, and then also trying to help each other as we think through how we can collaborate on some health issues. So we encourage you to be part of that. We'd love to see you in that group.